pleased to have Henri Rauschenbach with us. And he's a former state senator. He served 8 terms as state senator, 2 terms as a state rep. I think I've got that right. But he also served as an undersecretary and pretty much as a senior deputy chief of staff, both for Paul Cellucci and Jane Swift. And I remember him in those roles, in those positions. He was always someone responsive to disability issues. And he was one of the senators that got us to add money in the Senate caucus. And I remember that day, Richard Desai, and, it's going back a ways. And the chair of Ways and Means was Tom Birmingham at the time. He's running around trying to figure out why people are voting with the Republicans on adding money to, I think it was respite care. And then Tom Norton, who was majority leader, voted with folks to add money. And then in the second round, he abstained, which stopped the Second Amendment from passing. But I remember that well. And I remember your tenure, Henri, welcome. And I hope I didn't leave anything important out. But I remember you well. Oh, you're on mute. You got to unmute. You have to unmute.
There was a bit more balance in those days. It's
Totally.
not so much. And there was a lot more debate on issues. The budget process, when I started, the House would take 2.5 to 3 weeks, So it was a different world structurally. So I'm
Good
in
point.
the car. I just want to apologize, but I've got to get back to the Cape for a meeting. So I'm just leaving Boston. So I might go sort of dark at one point, but just
as long as
wanted
you
to
get back in. All right. Thanks for the heads up. And I just want to say you've been a lobbyist now for several years, right? Working with, when I say several years, it's been over, I don't know, it's got to be over a decade or more than a decade, 16 years.
Oh, I would. Yeah, easy. When Romney came in, I decided that my tour of duty in state government was over. Wasn't excited about the Romney thing. So I started then.
Yeah, and that was very different, right? From, of course, I thought the world of Jane Swift and was sort of disappointed, because of what happened there. And, but that's life, right?
Totally. Romney had all the money in the world and Jane lived 3 hours away. I mean, it was a brutal commute with twins, and her husband wasn't really that healthy. He's gone to his great reward now. But so then again, a different time, but the opportunity just wasn't there for her. So.
Yeah. Well, thank you for being with us, because I feel like you've got an unbelievable perspective. And, we're hearing from someone who's a moderate Republican. I shouldn't even call you a Republican anymore, because you're you have different clients from different perspectives, right? And in healthcare and other areas. So, I remember an aside we had at an event, where just basically you were unbelievably supportive on disability issues and other issues that people don't normally, connect today with Republicans. They did back then, but they don't connect it today. And so, which is a shame.
I think the word moderate Republican or Rockefeller Republican was germane then. Now, of course, the party, certainly in Massachusetts, is veered off quite a bit to the right. And if you looked at the membership in the Senate, the Republican caucus, when we went to 14, there were some folks that would have been to the right. But the core group were all just moderate Republicans that, were there on the social issues and on the spending side, some concerns about taxes and things like that, but mostly about the fabric, the social fabric and compact that we had with citizens, and how do we best sort of move forward on that. And, a very different sort of group as to what's being espoused nowadays. So.
Right. And that's something, as we talk about transition of governors, that Charlie Baker had to deal with as a Republican governor, right? That may have been
Charlie was your typical, moderate Republican coming in under Weld. Weld was
Right.
a curious soul. Charlie went into HHS, under Weld, and then wound up at A&F.
Right.
But Charlie obviously banged the drum on taxes, but I think was fairly open to the role that government played in the lives of the people of Massachusetts, and was willing to do what he thought was most appropriate as opposed to what was most politically expedient. So, Charlie was, I would just say, your typical moderate Republican governor.
And just to talk, since we're going to compare, we're going to guess, right, at what might happen a little bit, but we want to compare the two because that we have some facts about. You just pretty much outlined he sort of grew up in government, so to speak, right, after schooling. And he worked at the Pioneer Institute, went from there to be the assistant secretary to Dave Forsberg. You remember him? And
Yep.
But Dave Forsberg ended up in the hospital, right, with back surgery. So Charlie, as he would say back then, and this is a quote from 1991 or two, I carried some heavy water there. And I don't think he used the word heavy. I carried the water on deinstitutionalization. And again, the Republicans gave us the votes to stop any attempts to slow down deinstitutionalization while we had the numbers. Michael Barrett joined senators in stopping that, Republican senators. And then he went on, like, as you said, he became secretary, right? Full secretary. And then he became secretary of A&F. And I remember the big spread in the Globe about that transition, right? And then he went from there to private practice and from there back to government. Now, not private practice, you know what I mean? Healthcare. Right. And he merged a little bit of a hiccup. Tom Riley helped him out on the hiccup when the two companies merged, Bay State, I think, and Harvard Pilgrim. And he ended up salvaging that and working it through. So he had that private sector experience after that. And then instead of coming, historically from private sector to government, he actually went to private sector after government and then came back to government. And then you have, if we compare that experience and sort of that journey, right, to, and he, by the way, he lost one election, right? He didn't win right away.
He ran against Duvall, I think.
Right. And that was for the re-election of Duvall, right? If we remember right.
Yes.
And I remember running into him in Mull's in Dorchester, famous Mull's diner that no longer exists. And that was during that first run. But I think, he learned from that. He didn't let that get him down, right? And then now he's had two very successful terms as governor, despite an unbelievable pandemic, right? That we're still in the disability sector on, we're still dealing with and struggling with for people with disabilities. It's one of the things we've been advocating with across the board and with the administration on. And now, so that's his sort of journey. Maura Healey's journey is quite different. And the first attorney general to succeed in getting elected, I think in, I don't know how many decades, right? I think the last one would have been in the 50s. I'm just guessing at that, 1950s.
Oh, I think a number of run,
Yes,
tried,
yeah.
But
Frank Bellotti,
not been successful.
Tom Riley, Frank Bellotti, Scott Hartsbarger came close, right?
Yep.
That's pretty tough, right? That's a pretty tough.
Martha.
Right. Oh yeah, I can't believe I forgot Martha. Okay. So, I mean, what Maura Healey has done really is pretty astounding. And her journey's different. I mean, in addition to, I don't think Charlie ever played basketball, though he's tall, but Maura Healey, is.
Well, they both played at Harvard. Charlie did play basketball at Harvard.
Did he really?
He wasn't.
Okay.
He did. He wasn't the rock star that Maura was.
Okay. All right.
Maura was obviously, to play professional ball in Italy or wherever. I forget the country, but she did play overseas after her time at Harvard. So.
Oh, you're right. Yes. So different, very different experience that way, right? Learning, connecting with people in a different world that I'm sure enhances her experience. I know in her personal life, she knows people who have kids with disabilities. So I know she has that aspect. And Charlie did some best buddy stuff when he was in school, is what someone told me. Not necessarily formally. Best buddy might even been like one of those Big Brother programs. But she ended up growing up in New Hampshire, pretty much, right?
Yeah.
Uh, and then she, um, she attended Harvard, like you just said as well. And I think, by the way, she was a point guard on a pro team in Austria. So that was it. I should have looked at that earlier. And then she went to private practice, as many people do, and then became chief of the Civil Rights Division in the AG's office. Um, so I think, and then she wasn't elected to public office till 2014. So very different, right? Kind of experience.
A different experience, a different journey. Charlie, you would also, if you're doing the comparative, he was also a selectman or a select person, wherever you want to characterize it, in Swampscott or wherever he was living. So Charlie had a tour of duty at the municipal level,
Great point.
which is also, I mean, you get a lot of reps and senators that have been selectmen or town councilors or whatever. But, I think he may very, well, I shouldn't really say it, but he's one of the very few, that have had municipal experience and then goes right into being, the governor of the Commonwealth. So that that is a background that's, I think, rich and from education, all of the local issues, roads, bridges, absolutely everything. It's encapsulated in that kind of experience. So Maura's experience is very different, what she brings to the table to Charlie. But the difference, though, would really be that Maura's running mate,
Yeah,
Tim Driscoll,
right.
has, that whole urban mayor experience. Whereas Karen Polito, who was Charlie's number two, had been a legislator,
Right.
out of,
Without local, right? She didn't have the same municipal experience Charlie did, right?
she did not have that. She had, the experience being in the legislature. But Driscoll brings a lot to the table with that. But, what they don't have as well, though, was, dealing with the building, which is, of course, what would be on your mind, the
Yes.
State House.
Right.
I mean, interactive on some policy stuff like that, but not the viscerally intense stuff that being the secretary of A&F brings, or being the secretary of HHS. I mean, those are real intensely interactive legislative policy, funding, people, need, all that wrapped into one. That's
Yeah.
an enormous sort of robust background to bring into the office. But if you're smart and agile, which certainly the governor-elect is, and the lieutenant governor-elect is, that's, you can make that up in a fairly short period of time.
Yeah, and picking the right people, probably, Henri, to help.
Well, yeah, I think we're, next week, this week, later this week, next week, I think you'll see them start to roll out what the structure, the personnel structure of her administration will be like. It's timely to do that. I think you, as well as all of your peers across the human service provider and advocacy arena, are anxious to know who will play a role in this administration, where they come from, what they what they know of them, what they know their beliefs are, their visions are for the respective silos that they will lead. So it's timely to do that. And then, of course, you want to get as clear a view as to who will be advising the governor in 360, who the chief of staff will be, the policy, the policy folks that'll be in the governor's office. Having been in there, that's very important to the governor to have her own people looking through their lens at issues that exist across all the line agencies and secretariats and boards and commissions and things like that. So it's timely now that the general public and folks like myself that have a serious interest in who's in charge, that we see those folks.
Yeah, I just got knocked off, by the way. I don't know what happened to my Wi-Fi, but I just missed that last part. But I was looking at State House News, as I said earlier, and there really isn't, in a sense. Did you answer the question about the person from Rhode Island?
In Rhode Island? No, I didn't see that there was a question about Rhode Island. I haven't seen anything in writing here. But Leo, are you able to come back on?
Yeah, for some reason, Leo has been knocked off for a minute. So,
All right.
but there is a question in the chat, and we can just maybe go ahead and do. Would you expect replacement of DDS in the HHS leadership?
Well, I think HHS is the largest secretary by far, and depending on how you roll up, the numbers are responsible for 40-45% of all state spending. So I think the transition teams, but internally with Maura's group of advisors at this point, there's some serious discussion going on as to what HHS should look like. Under Charlie, a lot was merged under the HHS mantle, like Elder Affairs. 8 years, HHS has been the secretariat. There's been a secretary of Elder Affairs, but all the fiscal budget policy stuff ran up through the secretary of HHS. So, the big question would be, who would the next secretary be? And then from there, you will see what happens with commissioners and other policy people in the secretariat and in the boards and commissions that come under the purview of HHS. So, one of the big questions is, would the current secretary, Mary Lou Sutters, would she stay on through the transition, maybe through the first budget cycle, because that's such an enormous impact on state spending, the bottom line of the state budget, et cetera. There is talk that's been out that Governor-elect Healey would split housing and economic development. They were two separate entities in the past. They were merged. Now with housing being such a huge focus, should they have their own secretary? That's been talked about, but the structure of HHS hasn't. So we don't know who. She will pick their names that are being circulated, some of which should be familiar with.
Yeah.
But that's something I think we'll see in a week. And from that, then as these things go, generally everybody is interviewed, and their visions, their history, the role that they've played, how the advocacy community feels about them, et cetera. All of that is looked at and considered, along with who might be interested, who might be available to be a commissioner, whether it be developmental disabilities or any other rehab, et cetera. So that'll come, but that will come fairly quickly once the secretary is named.
And the secretary makes a big difference. We know from, this administration, the role that Mary Lou played versus other ones, and I can think of one, I won't say who it was, who really had a lot of difficulty with the legislature. And their top legislative liaison wasn't great either, even though he was from the Senate. And it really caused some problems once some people left. So it really makes a big difference in terms of that thinking as well. So what do you think in terms of policy in human services? Democrat or Republican, until Deval Patrick agreed to do a new funding strategy or formula for contracts, through Chapter 257, there had been no change, right, in the way rates were set. We had success through whether it was legal action or advocacy, right, in terms of more people being served, but there was no change in how people got funded per person, and those kinds of things, staff salaries. There's tension to this day, unfortunately, between union and provider groups. A little less pronounced than it was, but it's still there underneath. So how do you think, he navigated that pretty well as governor? The secretary navigated that pretty well. Do you expect the same from Governor Healey?
Well, the universe isn't static, and the universe of state spending, budgets, policy development, priorities isn't static either. So, the future of where are you going to sit in the priorities of a new secretary, would have to be evolving. But the issues that are swirling around is you've got, key components of the delivery of healthcare in the Commonwealth, hospitals and health centers. And I do work for both hospitals and health centers in the interest of transparency. The last Echo Dev stuff that went through, hospitals got $350 million, and then the secretary got another $80 million to spend to shore them up. And as your communities are hit with staff shortages, related to staff availability, but also keenly so salaries and wages. What are you going to pay them? So too, you've got hospitals that have been hit incredibly hard by traveling nurses due to the virus. The virus has really caused some serious problems with hospitals. Same thing with with health centers. Same thing with nursing homes. So you've got three large, pronounced players, not in a derogatory way, but interests,
right,
that are looking at serious needs, and they've been well publicized, those needs. So you come into this picture with, we're a couple of years into the ARPA money. I would venture to say probably unlikely that would see anywhere near the kind of money coming out of DC particularly considering the shift in the House,
Right.
which can only be, I think, anticipated to be more conservative from a spending point of view than the last two sessions of Congress that have been dealing with the virus and their response to it. So the ARPA money has been key to significant investments in hospitals and health centers and nursing homes, and across all kinds of levels with the economy, hotel workers, etc. The question is, what will the priorities be of the administration? What will the priorities be of the Secretary of HHS? How much of this money is left? How much will be spent now? There's a timeline to spend it. I think it's to obligate it. I think it's before 2024. I could be wrong on that. And then it has to be spent, I believe, by 2026, but it may be 2027. So there's distinct parameters for how and when this money will be spent. So your, I think, question would be how does your community fit in that? Is it a new ask? Because the line will be very long. I mean, then you throw in just the schools.
Right. Schools, cities, right. Cities and towns.
Cities and towns that that have gotten a fair amount of money out of the ARPA. And some have spent it, some haven't spent it. Some people are sitting on a lot of money. A lot of the state money that we have put into reserves and A&F, significant chunks of it will go out in a couple of weeks from HHS, but some of it sits there available. So how are we going to spend what money we have left of this? And then when will that happen? And then what will this budget look like, the first budget, which
Right.
I think would be your first effort to influence a new, the governor-elect.
Yes.
Governor.
And
What will this new budget look like? Well, this budget will come a month later because new administrations, in lieu of them filing the budget like the third Wednesday in January, they get a month, an extra month, because you've got to do a forensic look at what we're spending our money on, talk with the financial folks in the line agencies, look at trends, get the revenue estimate from the legislature, look at what's going to be reverted potentially from this year's budget, this year's spending, how that trends. All these factors go into it, and they will influence how much money the administration wants to spend on rates, et cetera.
Right.
And if indeed, whether or not you would have a formal rate hearing process or not. If you're looking at rates, would there be a formal process that would go through where the administration would collect, information, data, numbers, look at, impacts on, key providers in your field, all that kind of stuff, patients, individuals accessing your services, what's needed or what's not, and are rates the cause of it as opposed to demographics or some other thing, So there'd be a lot to be done, as you look to sail your ship in the right direction into this fiscal storm that we're in.
From where you sit, the fact that our broad area, not just disability, human services got 225 million in the ECO package. Does that, in your head, compare favorably with how the hospitals did and other groups? Or does that show, we clearly haven't gotten as much publicity, we've tried to get it, but of course our world's dispersed, right? And it's basically in some of it's in family homes, families are like 60%. of the adult service provider. And they've
Yeah.
probably gotten the least assistance when we've advocated. We've tried to get it across the board, And would you say, based on the numbers you shared with the hospitals, even though I bet you there's a lot more people touched by human services across the board than in hospitals. I'd have to do a numbers check on that. But obviously it's not apples and apples, it's apples and oranges big time, right?
If you just sort of gauge it, there are 56 hospitals. And, the traveling nurses, MHA put out a report, and if I'm wrong on the number, I apologize, but I think they said that we'd spent about $1 billion paying for traveling nurses because a lot of our nurses, because of the virus, et cetera, decided to become travelers. You can make a lot more money as a traveler, in hospitals, would lose staff, nurses out, nurses retiring, worn out, exhausted from the pressure, et cetera. So a significantly high profile. And then you wrap, economic development, the impact on cities. Bay State, who I represent, employs 14,000 people, although now I think it's down around 12, because they've had staffing issues and they have to pay to get nurses, to get CNAs and all that other kind of stuff. So very high profile. Same nursing homes, seriously high profile with, the tragedies that occurred home to home.
Yeah.
So your 225 million is spread across a really diffuse cohort of providers, from individuals, to larger organizations. And it's not as clean a look as a one-stop shop for what the impact has been.
What a
It's
great
a matter
point,
of-
Henri. That's so well said. Yeah, that's, we have to look at things the way the world looks at it, right? And what you just described, nails it, in terms of the difficulty, right, of making our presentation, our argument. And obviously I care more about disabilities, right, than the other pieces, but I try to work with other groups. We try to work with other groups because it's so important, right, to be together. But sometimes it's not as clear when you do that, right? It gets more diffuse when you go in as human services. I don't know if it helps the argument, or do people should collaborate and define their groups by the disability or the issue, children, right? Children who need families, right? There's so many mental health issues, if we need to,
and then I think as well, the other sort of difficulty is, sort of issues that your cohort of folks deal with. You'd mentioned, mental health. Well, look at the emphasis the legislature, particularly the Senate, has, although that's not fair to say to the House. The House was very much a party of it, but the issue of behavioral health and the energy that we have made to focus and target behavioral health, results of the virus, and a variety of other things all rolled into that behavioral health ball. And your providers, your diffuse group of providers, some are part of that and some aren't.
Yes, right.
And, the question is, are they presenting, as the function of the disability community, or is behavioral health now its own community?
Well, I think what you just described, though, sort of makes the argument, right, against diffuse, because of COVID, it amplified, right, behavioral health needs. And behavioral health might be a fancy word, but really it means combination of mental health issues, combination of behavioral issues, right, drug addiction. There's a bunch of things fall under that rubric. that are all legitimate health needs, right? And that might even
Totally.
include, right? It might even include people with autism or intellectual disabilities who have severe behavioral issues, for all we know. We're trying to look at the bill, the law in its fullness, right? And figure that out. But I think I think your point, though, even though behavioral health is a relatively new term, sort of makes the argument against diffuse, right? Makes what you were saying earlier about hospitals, 56 hospitals, nursing homes, it's pretty black and white. You can see what the impact is. I think we have to do a better job of sharing our world, right? And taking the sort of scattered pieces of our world and defining it better and consistently, which we've tried to do at the ARC, but it's an ongoing thing. As you said, it's evolving, the policy and people's reactions to it.
Well, I think you have to see how linked into that. I mean, that and other issues as well, economic development. You've got a variety of initiatives that have been put forward to shore up the economy and reassure the population that we care about them and we want to be partners with them in, their health, the health of the community, the health of the individual, mental and physical, etc. In many respects, you have to see how you line up with, economic development issues, workforce issues. You are involved with workforce issues.
Yep. Yes.
You're making stuff. You're providing a service to communities that you're in, whether it be agriculture or otherwise. You've got a variety of threads that are woven into the bigger picture that could provide, an enhanced level of resources if the appropriate for your members, if it's clear enough where they are and what they are and how you can access them, other than just a pure rate per se.
Yeah. Yeah.
Rates are rates, but your members, you've got such a variety of things that those rates buy. And it's not all like just nurses, which is you want to rate for nurses, fine. But you've got a lot of components in your workforce.
Right.
But I think that there's a fair amount of money sitting there. It's a matter of identifying it, finding it, identifying it. And is it suitable for your members? And is the 225, how's that going to go out? What's the process for deliberating on how that's apportioned? How long is that going to be apportioned for? Is this a 1 year rate?
Well, part of it's annualized. 125 is additional on what the governor did. The governor put 230 on the table. This brings it to 355. And then on top of that there was more 1 year monies, which I think they're still debating on the administration side. What strikes me is many families and individuals who go to different providers, right, who are in need. I was thinking about the workforce piece, like you just said, workforce development. There's people with disabilities who could benefit from that. And there's our workers, our direct support workers who could benefit from that, right?
Sure.
But each of those areas, education, each of those areas, like you said, we have to tie in the threads. I think that's a great point. And I think a different way, for our folks to think about things, our constituents to think about things as well. So it's, we're almost done with the 45 minutes. I'm wondering if I should give people a chance to ask a question. I have to say, Henri, this is like an important piece of thinking about the future, what you just did today, okay, with us, where you really laid out how to think about this, how to think about the change, where we are in relation to other issues, right? The long line of issues, what those issues are. You labeled some of them. In the old days, you're going to laugh at this. I knew people well at the state police. So I would keep in touch if there was a huge reduction, right, during those tough years, or a huge gain, and see how they were doing and think about it proportionally, what they were getting. It sounds absurd. Anyone listening right now is thinking I'm probably crazy, but it would give me an easier way to assess things than if I really tried to think about cities and towns, right? And healthcare and education monies, right? I would potentially have trouble like absorbing all of it and the different issues, right? That were powerful at that moment that might give them a separate, heads up, right? Or a leg up on a situation. So I think what you did today was in a really summary fashion, talk about, the reality of policy and the importance of all the different aspects of
Yeah,
policy.
Leo, just let me jump in before you try and close. I mean, the other thing you have to think about a lot too is how do you interact with this legislature, which is there are many, many, many new members, and there are many, many members that just aren't used to coming into the State House.
Yes.
So your advocacy has to be as much local as it is, bringing everybody to the State House or working the State House, because there's some reps that very rarely ever go in. And they're used to their exposure. It's like 40% of the legislature has been there 2 terms or less. I'm not sure that number. Don't.
No, I think you're right. No, I think you're in the
it's a
ballpark.
significant number. So
Clearly, in the last 3 terms, there's been a huge turnover, like more than 50%, in the last 3 alone. And then, like you said, whether they were in the legislature or not over the past 2 or 3 years, they weren't coming in. They weren't flexing their muscles as much, right? You have that issue. And then you have the local piece. And then we have to prioritize with our chapters and other groups who are the right local people, right, to go. And sometimes they have affinity for us, and sometimes they're a position of power who can help us.
It's just so different than walking around the State House and is the rep in or is the chief of staff, and can we have like 20 or 30 minutes? It's just, I think it's different. And
Yeah.
that is some time as you prepare for this journey through this new administration and a new legislature and a new budget cycle with all the uncertainty. The strategy has to be, I think, a little bit different, just so you can have the impact that you want to have.
Yeah.
And have folks understand and know your issue.
Yep.
In concert with all the other issues that they're going to be confronted with, which are many, to put it mildly.
Right. No, and I think, yeah, the legislative strategy's got to be more nimble, because we could never keep up with 200 people, right? As a statewide organization. So we have to have our partners locally involved, as well as, thought leaders locally, family members and others, people with disabilities. So somebody asked about more support and services from DMH. I think we're thinking about people that might have dual diagnoses. And that's been, by the way, a 50-year problem, 60-year problem, getting DMH to work with people who have cognitive impairments or executive functioning issues. And I think that what Henri's told us is, let's find out who gets appointed, secretary and commissioner. And that would be the job, to spotlight the DMH commissioner. Also, what legislator, right now it's Senator Cindy Friedman, who's been a key proponent. I don't know if you think of anyone else, Henri, that would be helpful in explaining the situation. Like if you went and said, hey, here are the issues, Karen, that we face and difficulty getting services from DMH, senators such as her, maybe on the House side, Jim O'Day, and I'm trying to think of who else, Ruth Balzer. I don't know who.
Yeah, I think you target, if you're talking about Senator Friedman, sooner or later, you have a discussion on behavioral health and how dual diagnosis would be viewed in that context, because that's, is that behavioral health or not? It crosses, it straddles, several different issues, but it's a component of one. And from a resource point of view, is the broadness of this behavioral health initiative, does that have capacity in it to shine a light on dual diagnosis?
Yeah. No, that's great. Well, I want to respect your time and everybody else's. It's 12:47. We're on. This was really fantastic, Henri. I really appreciate the time you gave us. This is going to be, it is recorded, so it's going to be posted, and we're going to promote the session. I think I messed it up a couple times getting kicked off, but I think overall it's pretty coherent session that people will benefit from, even if they weren't live with us. So thank you. Thanks for being with us.
Sure enough, anytime, Leo.
All right. Take care. And everybody else, have a great day. Let's work together and get some stuff done. Take care. Have a great week. All right, Carrie, I'm just going to end the meeting for all.